Hello, everyone. Thank you for being here today. I'm Jen.
And I'm Anna, quick correction, social science teacher. And we're both from Northside College Prep High School in Chicago, Illinois.
We're representing Asian American Hope, which stands for Health, Outreach, Prevention, and Empowerment. Our project focused on promoting health equity and mental well-being for Asian Americans in Chicago.
Before we dive into our project, we wanted to emphasize why this work is so important. Asian Americans are the fastest growing group in the US, yet they often face significant barriers to well-being. This unaddressed need ignited our project's hope to bridge these gaps and empower our diverse communities. Aligned with this commitment, our mission is to connect trusted, low-cost healthcare providers to Asian Americans facing barriers to accessing them by building partnerships and providing culturally relevant information and resources. With that, our vision is that Asian Americans have equal access to quality healthcare, free from cultural barriers, so they lead long and healthy lives. Our team is comprised of students representing diverse Asian American backgrounds, languages, and ethnicities across an array of high schools throughout in Chicago. We meet biweekly with each team member's strengths fitting together to create our multifaceted team. With sustainability in mind, we also created a line of succession for leadership by recruiting a vice president and apprentice who carry the project into future years.
Next slide. So, to understand our community's needs, we surveyed Asian American youth, adults, and healthcare organizations across Chicago to better understand the barriers they face to healthcare. We asked about their experiences using healthcare, their mental well being, and also challenges in accessing services like primary and specialty care. The survey gave us a broad understanding of what barriers were most prominent, but we still wanted deeper insights from stakeholders working directly with these communities. And with that in mind, we conducted a focus group with staff and researchers from the Chinatown Patient Navigation Program, which connects Chinatown residents to culturally relevant care at a local university. And these experts shined light on how transportation difficulties and stigma around help seeking were major factors contributing to poor mental and physical well-being. And bridging the lived experiences of our survey respondents and the expertise of professionals in the field, we reached out to nonprofits across Chicago to narrow our focus. And through that process, we're thrilled to be collaborating with Project Vision, a youth nonprofit dedicated to serving Asian American families in Chicago's Chinatown neighborhoods.
So during our initial meetings with Project Vision, we strove to meet our community where they were. Our survey data shaped our understanding of the community's most pressing concerns, where 81% have trouble affording healthcare services, 68% fear seeking mental health services due to stigma, 62% have limited English proficiency, making health literacy a major challenge, and 56% have faced racial discrimination or feel that their healthcare providers misunderstand their cultural backgrounds and beliefs.
To address these needs, we're creating a wellness space that will serve as a central access point for essential well-being resources. This space will provide free first aid and stress relief items like fidget toys, and a digital website and physical bulletin board in the space to connect users with culturally competent mental health providers and low-cost services. And it'll act as a core space to host workshops in Project Vision's office on identifying and managing stress, especially in the face of cultural stigmas. Next slide, please. We're excited about the impact we'll have with Project Vision and its surrounding neighborhoods upon our official launch in April. So the space will be used by families and youth Project Vision serves, where 93% of students are low income and 96% come from first generation families. We're incredibly proud that our space will be available for over 2,000 families and 1,200 students.
To both sustain and magnify our project's impact, we created a timeline for growth. Through measuring our impact through quantitative surveys and qualitative interviews with people using this space, We hope to adjust what our space offers based on student-centered feedback. Part of this includes connecting with and adding a new mental health providers and culturally competent services to our directory, along with hosting workshops best suited to the user's needs. In addition, to continue providing first aid and stress relieving items, we hope to host donation drives across Chicago and the nearby Chicago suburbs to grow our volunteer base while consistently providing our users with health necessities. Lastly, by collaborating with our advisors, we hope to initiate a peer matching program in later years where users are matched to offer each other support and build camaraderie. By committing to these goals, we aim to create a sustainable and dynamic wellness space that evolves with our community's needs.
With that, thank you to everyone who's helped our ideas come to fruition, especially Molly, AJ, the BSP staff, and the Asian American Hope team. If you have any questions or are interested in partnership, please follow us on our Instagram or email us. Thank you.